This is Rachel Dworkin from the Chemung County Historical Society, recording for the COVID Memory Project. Today is April 22nd, 2021, and I'm here speaking with
Rob Toonkel, Manager of Volunteer Services at Arnot Ogden Medical Center.
Okay, let's get started. So, how did COVID impact the Arnot Ogden Medical Center?
COVID completely changed the equation. From the time we got our first patient on March 20th, 2020, it went from hospitals being something where we treat people and get them better and get them back to we're dealing with something that's going to be going much longer term. It was something we hadn't seen in 100 years and that no one had experience with.
Okay, so tell us a little bit about like how that went for the staff, for the volunteers, for you. What did that feel like? What were you doing? How did it change the procedures within the hospital?
So hospitals are ready for anything based on you never know what's going to come in the door. And it's not the first time we had seen something that was potentially going to be long-term. We had H1N1, we had Ebola, we had SARS, and you treat every single one of them like it's going to be something, but there's also a part of you that says, this isn't really going to happen. We're getting prepped and we're ready, but this isn't going to be as bad as they say. And then it came and everyone was on it, just like any tragedy, like any emergency. Everyone's there, everyone's ready. It's heart pounding, it's exciting, we're getting through this. The only problem with this one is that it didn't abate, it just kept going. And there were all these beliefs at the beginning. Oh, this will be a couple of weeks, this will be a month, this will be 2 months. But you've had to keep your foot on the gas pedal the entire time. And that is an exhausting experience in healthcare where you've been taught, you've put all your emotion, you put all your energy into this, and yet tomorrow is the same as today, and the next day is the same as tomorrow. And to keep your foot on the gas pedal for that long has been a major challenge.
So how has it been impacting the mental and emotional health of your staff and volunteers? Has the hospital done anything to sort of help with that?
Everyone's done a bit, from the beginning. Places brought in free food and people sat in the parking lot and honked, and people made signs, and even to this day, they've made cards that they've sent in to us. But it's a different equation. Usually in the hospital, when one unit is struggling, there's another unit that's okay. So perhaps in the most tragic of circumstances, which I've seen in 18 years of healthcare, is when we have a child pass away in the ED. You can feel it, you can see it, you can sense it. And the ED is struggling. But then you go to food and nutrition and they're doing okay, and you get that balance off of it. And of course, by the next day, that feeling is a little improved, and so on and so forth. Here, everyone's under the same stress. It doesn't matter what department you're in, whether you're in billing, whether you're in health information, whether you're a nurse, a doctor, whoever you are, everyone is feeling that stress. And so when you go and you turn to somebody else in the hopes that they're going to help you out of it, they're struggling the same. So we've dealt with this, and a lot of our support has come externally. We've also done things inside. We've done some very interesting and special things. We've chalked sidewalks, and we've made hospitals out of Legos and, those supportive messages. But that's really hard to do for 14 months. As I've said through this thing, this is not appendicitis, it's cancer. Appendicitis, you buy the person a gift, you visit them in the hospital, and then they're better and it's over. The struggle when someone has cancer is everybody is there on day one, pink ribbons and everything, but cancer isn't cured in a day. And then you go through this long period, and where are all those people? To our benefit, to our community's benefit, we have had a lot of people there. But there can't be as much given in as there has been taken out by this pandemic.
Okay. So you're the volunteer coordinator, you said, correct?
Volunteer manager, correct.
Volunteer manager. What was the policies with regard to volunteers while this was going on? Were you still allowing them to volunteer? Was there a screening process? What was happening in terms of policy changes, if any?
So we, at the start of this pandemic, when it became very obvious it was coming here, we suspended all in-hospital volunteering. And given the nature of volunteers themselves in this community, that was disturbing to them because they said, we can do this, we're fine. So we kept engaging them. We actually sent projects. We still do a lot of paper projects that they could do at home, making charts, making packets for different procedures. So they were doing their work from home. In July, we became one of the first hospitals in the state to allow them back. And that was very exciting for them. It was hard for some of their families, as many of these volunteers are aged, and the volunteers themselves said, I made it through the Depression, I made it through World War II, I made it through Vietnam, I made it through all these things. I'm fine. And their kids said, Mom or Dad, I don't want you volunteering there. So of the half of those that started with us that came back in July, about half of them didn't make it back after a few weeks. They told us, I want to be here, but my family won't let me be here.
Okay. Did you have any volunteers get COVID while they were working with you guys, or no?
We have not had a single volunteer get COVID from their experience in the hospital.
Oh, excellent.
We did put in a lot of procedures in place of places they couldn't go, which to them seemed a little bit too much, and I tend to go toward the conservative, and the one thing you don't want is to go to somebody's funeral because they got COVID while they were volunteering.
Understandable. What about the staff? Did anyone on staff get sick with COVID?
We have had plenty of staff members sick with COVID. There is only so much you can do. We had great quantity and quality of personal protective equipment. We had policies and procedures in place. A lot of things around COVID positive patients. But the thing is, you never knew who was positive. You knew who had tested positive, but because even though someone tested negative, they could come down with COVID and have been contagious all this time. And so you walked around with that risk. You walked around knowing, okay, I better wear the eye protection, I better wear the mask, I better follow these procedures and policies. We didn't lose anyone to COVID, but we had plenty of staff members, family members pass due to COVID, not contracted through the staff member, but contracted elsewhere.
Okay, that's sad. Tell us about the policy changes that were in place to protect the staff and the volunteers from COVID.
So we went whole hog like everybody else did. I mean, disinfecting surfaces. If anywhere in the hospital you had to be wearing a mask. If you were anywhere around patients, patient care, any other humans, you had to have on eye protection. Not glasses, but full covering eye protection.
Like a face shield or
like a face shield or the goggles that covered the side. If you were around COVID positive patients, you had to have the gown. Now on COVID positive units, they wear the Ghostbuster style ventilator backpack, all of that. Because it was said to do, we did a lot of disinfecting. Obviously, we know now from the CDC it doesn't spread on surfaces. It spreads through droplet precautions. We did a lot of social distancing. There were lines on the floors everywhere from the cafeteria to checking in to maintain that 6-foot distance. We took away tables from the cafeteria. We took away chairs from break rooms, chairs from waiting rooms. Every day you came in, you had to be screened, have your temperature taken, which still goes on today, be asked questions. We had very significant travel restrictions in place, depending on what the state said, that if you had gone out of state to any of the states with high levels of COVID, you had to quarantine for a certain number of days, or you had to get a COVID test. If people were thought to be exposed, then they had to get COVID tested. I myself had to get COVID tested for a possible exposure. So we were very vigilant because obviously once this thing gets in, it could spread like wildfire if people aren't protected.
So tell me a little bit about what it was like to get COVID tested. Did you have the rapid test, the less rapid test? How does that all work?
I had the one up the nose.
Okay.
We tend to back then, especially when supplies were limited, we rapid tested people who we truly suspected were exposed. I had a very limited exposure with someone. I was had everything on. This gentleman was not presumed to be COVID positive and later turned out to be COVID positive. So I was offered the chance at the COVID test. I wanted it to be certain. That swab goes very far up your nose. The nurses who did it were extremely good. They warn you. They tell you what it's going to feel like. They're right, but there is no description of it.
It's like having your brain scraped.
It just keeps going further. And it's a very interesting experience because once you've been COVID swabbed once, you take extra precautions and you go beyond because you don't want to do that again. And you saw the same thing with COVID itself. Obviously, throughout the nation, this is a rumor, this isn't real, it really isn't that bad, only sick people are getting it. You watch that change as people started knowing people who had COVID. We had one staff member who lost his mother. We had another staff member who lost her mother at a young age from COVID. And as you saw that happen, you saw people, oh, wait a minute, this is real. And so that reality of once you're in it, you go above and beyond. You take even more steps than they're suggesting because, at least in my case, a second swab, I wasn't going to do it unless I truly had to.
Makes sense. So they started vaccinating healthcare workers at hospitals. Can you tell us a little bit about the rollout of the vaccines for the hospital staff and volunteers?
So on December, I believe it was 17th, we got our first dose of vaccine. And it was a very exciting moment. We didn't know how fast it would come. We didn't know how much we would get. And they started vaccinating the frontline workers. And we went through that vaccine really quickly, and they gave us a second batch. And I will not forget on Christmas Eve, because people were coming to me and saying, do you know what the story is with vaccination? Do you know when we get a vaccination? And I got the question so many times, I went and asked. And they said, we've got plenty. Anyone can come. And I sat in a room for 2 hours to get my vaccine that day, Christmas Eve. And the excitement was palpable. It was kind of, wait a minute, this might have an end. There is hope. And again, people sat in that room for 2 hours just waiting, doing everything. And once we got through that, all those staff members, they said, you can vaccinate the volunteers. And I started calling volunteers, and they couldn't believe it. They couldn't believe they were being offered this opportunity. And my response was, look what you've given. You're on these lines. We've gotten our frontline workers. Now we have enough vaccine. The state's afforded us. Here it is. And I think part of it was getting the vaccine, and part of it was them being able to tell their families, look who got it first, because they were here as opposed to the public lines, which hadn't even started yet. And so it was a very big privilege for them. In the hospital, it created this sense of, again, this is ending. It was the first sign of hope. And it really picked up people, again, this being late December, early January, at a time when we really needed it. Now, obviously, because that vaccination start didn't go as well nationwide as we had hoped, and COVID is still an issue, we haven't been able to throw off the masks, and we haven't been able to return to normal, but it has given people the sense of, okay, there might be an end to this.
Did you guys have anyone on staff or in the volunteers who didn't want to get vaccinated?
We have had plenty of people who don't want to get vaccinated.
Have they talked to you about why?
There is always a feeling about new stuff. Several of these people lived through thalidomide. They lived through the swine flu fiasco in '76. They lived through these things that they were told were safe and that didn't turn out to be safe. One of the biggest groups who is afraid happens to be women of childbearing age, because like anything new on the market, you don't know what it could do to childbearing women. Some of those childbearing women have said, give it to me. I'd rather not get COVID than, worry about what this does. Others have said, I'm just not comfortable yet. It's just too early for me. I might be persuaded down the line, but not right now. Volunteers, of my entire volunteer team that I offered it to, only one turned it down.
Okay. So outside of the hospital, how has COVID impacted your daily life, your daily routine? What's going on in your life?
It has completely eliminated it. For 10 months, my schedule was work and home and work. There was nowhere you could really go, anywhere that you went that you wanted to enjoy. There were signs and there were worries. I mean, you didn't want to go to a park because either the park was closed or you were worried about somebody else who wasn't masked and their group of whatever and what they had done. Restaurants opened, closed, partially open, then partially closed. You couldn't really travel because of the travel restrictions in place. And so it put a stop to everything. And you felt that. One of the first things I did when this thing started was I went around and asked several hundred staff members, what is the first thing you will do when the restrictions lift? And of course, back then we thought it would be 3 weeks, 2 months, whatever. The amount of people that said I would want to go and visit my family, I'd want to go to the vacation place I go every year. All those places that people went on vacation for all those years, 20 consecutive years, 30 consecutive years, last year was the year they didn't go. And that added to, obviously, the stress. Your outlets, gone. The softball game, gone. Bridge club, gone. Really amplified the stress and the worry everybody was feeling.
Okay. Do you have anything else to add about your COVID experience, the hospital's COVID experience? Anything else?
It has been an interesting thing to watch. I started my healthcare career in the emergency department for 7 years, where everything is bring it in, stabilize it, treat it, hopefully get it out the door walking or admit it to be treated further. Coming in with that perspective, this is completely different. Now it's when it walks in the door, suspect it has COVID, and recognize that this is going to be going on for a long time. And that has been a mindset struggle because it's not the way you're brought into the game.
Okay. Thank you very much for speaking with me today.
My pleasure.